Health saving account, not everybody knows that people are eligible for health saving account who are in high deductible medical plans, and people who benefit from health saving account are in higher tax bracket. Happen to be also, people don't realize if you put in money in the bank in health saving account, you're allowed to invest them, which sounds to me the same logic. Investing money that you need tomorrow for health needs is essentially the same as offering mortgages to people with down payment. So my question to you. How does health saving account, and I have to tell you that member of my family is contributed from health saving account, so I'm familiar with it. How does health saving account contribute or help to control medical costs when there is no actual market of medical service and one cannot really choose where to go? Obviously, in an emergency situation, one shouldn't choose, but if I go to like a checkup or regular family doctor, occasional visit, why I cannot see how much this doctor charges versus another doctor, or when I go to dentist, how much this dentist charges versus another. So if that market doesn't exist, in my opinion, health saving accounts is basically smoke screen essentially for people to save on the taxes. So at the same time, health saving account, which people using them more and more, become drawback on revenue and contribute to deficit?
Well, I can answer that two ways. First of all, a flexible savings account, where you put pre-tax money, I believe, up to $5,000 this year and down to $2,500.
Not flexible, health saving account.
Or HSA.
Yeah.
With an HSA, that is designed to cut down on the administrative costs of health care. Because with an HSA, anybody who has one of those has got to buy out of the proceeds of the HSA a regular insurance catastrophic policy with a big deductible.
Right.
And all of the expenses that they have before they reach the deductible essentially are turned into cash transactions. You write a check out of your HSA to the doctor or other health care provider. You get a receipt, you put it into an envelope, and then if you hit the deductible, you turn all the receipts in with your first insurance claim. We presently spend about 30% of our total health care costs on administrative expenses, which are filling out insurance forms, processing them, issuing the payments, correcting the mistakes, and that does not make one sick person better. So the HSA is designed to reduce the administrative expenses so that a higher percentage of our total health care dollars actually go into making sick people better.
To all due respect, it has nothing to do with that, because medical offices bill exactly the same way, and insurance company acts exactly the same way.
But if you have an HSA, you don't have a $1 insurance policy. You only have an insurance policy when you hit the deductible of the catastrophic that you have to buy in order to qualify.
Right. All you do is basically taking money from health saving account and paying you, because you're allowed to use the health saving account for medical expenses. Mm-hmm. But process of paperwork is exactly the same.
No, it's not.
Exactly the same.
Well, then it's because your doctor's making it exactly the same. The intent of Congress in having health savings accounts, is number one, basically to put patients and doctors rather than insurance companies more in charge of health care, and as I've said a couple of times, drive down the administrative expense. Now, you ought to have a chat with your doctor if he wants to have the same administrative expense when you write out a check from your HSA and his bookkeeper issues a receipt before you walk out of the office.